Madam Chairman, I have reviewed the minutes of our last meeting, find them to be in order, and without objection, I move for their approval.
Very good, thank you. Do we have a second? Very good, Ms. Carroll, second. All in favor, please say aye. Aye. Any opposed? Very good, thank you. All right, Health Department, welcome.
To Mayor Ketron, Madam Chairman, and Commissioners of the Committee, good evening. Tonight I will be presenting the Health Department report of Community Health Outreach and providing COVID-19 updates. If you will at this time, please take a look at the August 2021 report of Community Health Outreach. Our 3 columns labeled Protect, Promote, and Improve continue to increase just a little bit as we continue to provide vaccinations and do testing efforts around COVID-19. We've also been able to be in the community just a little bit to participate in such activities as the Borough Pride Festival, providing sexual health education and information, and National Night Out, providing tobacco education and information. We also continue to do most of our outreach in the community via telemedicine, as well as being able to provide some child health, children's health, and then also some additional screening. At this time, we're going to move on to our COVID-19 updates because we have quite a lot to go over since our last meeting. So our drive-through testing will continue to be available Monday through Friday from 8:30 a.m. to 12 noon. We are still providing Everlywell self-test kits to individuals ages 16 of age and older. They're available at both health departments, Murfreesboro and Smyrna, as well as State Farm. We will also work to continue to partner with other testing company in the near future to provide opportunities for testing over the weekend, as we do see this as a need here in our county. Along with testing, we also continue to promote public health and provide public health investigation that goes along with our positive cases and their contacts 7 days a week. Additionally, according to the Tennessee Department of Health dashboard, Rutherford County over the last 7 days has averaged a positive percentage rate of 14.5. This is slowly declining from where we currently were, which is roughly about 20%, so we're going down just a little bit. And we are currently have roughly about 2,000 individuals active cases with 75 new cases just within today. Furthermore, since our last meeting, we also been working with our amazing city and county public information officers to help assist with consistent and clear messaging and information regarding COVID-19, which is being shared via social media, on our city and county TV, along with our community partners. Also, in an ongoing effort to maximize our outreach for testing and vaccinations, the Rutherford County Health Department will continue to support our school systems, universities, churches, and workplaces to provide education and guidance. Now, moving along to vaccinations. So for the next 2 days, our COVID-19 vaccinations will continue to take place at our Murfreesboro Health Department located here at 100 West Burton Street. But beginning this Friday, October the 1st, thanks to Mayor Ketron and our good neighbors at State Farm, we will transfer all COVID-19 operations, including vaccinations and testing, to the former State Farm Operations Center located at 2500 Memorial Boulevard. We do ask that anyone coming wishing to be tested or vaccinated enter from Desjardins or Desjardins, depending on which way you say it, lane. With an increase in the number of tests that we are performing each week and considering also the number of vaccines that we will be administering with our booster and third doses, we felt the need to move back to this operations and have an alternative location. We have been working alongside with our Public Safety Director, Chris Clark, to create a traffic and flow plan to ensure that we're being efficient and also delivering these services that are very important while maintaining an experience that is convenient for both our community and our workers. Also, I want to take this time to thank our IT Director, Cody York, and his team for being a phenomenal asset to our Rutherford County Health Department, ensuring that we have everything IT needs at State Farm. Just want to remind everyone, as far as our testing and vaccinations, there is no appointment that's necessary. Vaccinations will be administered Monday through Friday from 8:30 a.m. to 12 p.m. And then we have a lunch break in there. We'll start back at 1:30 to 3. Once again, it's free. No appointment is necessary for the vaccination, and currently we are providing Pfizer only. We do expect to receive Moderna, and right now Moderna has not been approved for the third dose or for the booster at this time, just Pfizer only. So the number of single vaccinations reported in our county is roughly a little bit over 300,000, and out of all eligible residents ages 12 years and older, Rutherford County has vaccinated 49%, so we're slowly but surely increasing up to that number. Finally, as we go into the fall season, I want to remind us all of the 3 W's: wearing a mask, watching your distance, and washing your hands, and the 3 C's: avoiding crowds, close contact, and confined spaces. Once again, as a reminder, on Friday, October the 1st, the Rutherford County Health Department will be removing all COVID-19 vaccinations and testing to the former State Farm Operations Center located at 2500 Memorial Boulevard. The single-dose Pfizer boosters will also be available at this site. Dr. Mack will be providing us with more information this evening concerning the Center for Disease Control's recommendations for booster doses that has been approved as of last Friday when we started administering it. So at this time, I'm going to turn it over to Dr. Mack to talk a little bit about those CDC recommendations.
Thank you. I've tried to just break it down into the boosters and the third dose people, because there's just tons of information and it can be very confusing, so I've made it pretty straightforward. So boosters, you have to be 1, over 18 years of age, you have to have had at least 1 Pfizer vaccination, and it has to be at least 6 months after that second dose. Those are the only 3 things you have to worry about. The third dose people, they can self-declare their immune-compromised state. I mean, there's a ton of things that immune-compromised people, and we're not checking. So if they come and they say, I have this, this, and this, I have coronary artery disease, etc., they're good. Has to be at least 28 days since their last vaccine. And Pfizer, is okay if one of the 2 previous doses have been Pfizer, you can get Pfizer. Moderna's not in the mix at this point. You have to be 12 years of age or older, and if you had Moderna number 1 and Moderna number 2, you can get Pfizer for number 3. So that's pretty straightforward. Everything's a self-declaration. We're not asking people to show us your, chronic leukemia card or anything like that. And but essentially, we just want to get people vaccinated. So it's pretty straightforward, and if you have any questions, the people that work with us will ask you these very simple questions, and then bring your vaccine card if you have it. That'd be great. If you don't have a vaccine card, we can look it up, but that slows us up. And if you need a vaccine card, we can reproduce it. That's pretty much it. Yes.
Yes.
Dr. McDonald, do you have a recommendation for, in essence, the booster? And I'm not sure I caught the difference between a third dose and a booster. That again.
Yeah.
And if you do have a recommendation as to who maybe should get a booster after they've already been vaccinated twice.
Well, I can give you some of the, with regard to the boosters. Of course, we're not talking Moderna at this point because they're in the process of it. We do know that after 2 vaccines, on average, Pfizer vaccines, you're 77% or so protected. Moderna's about 92%. No one knows why. They think it might be, there's a couple theories out there. The Moderna was a 0.5 cc dose and the Pfizer was a 0.3. The Moderna we did 28 days later, and the Pfizer we did 21 days later. So that may not have anything to do with it. Those are the only major differences. So Moderna's been a little slower to get their booster dose approved because most people are sitting at 90% if they had those first 2. And your other question was about the third dose or the?
What's the difference between a booster and a third dose? And if you have a recommendation, let's just say if someone is homebound and requires constant care would.
Yeah, oh, absolutely. I mean, for me, my threshold is very low. I just want people to get vaccinated and be safe. We can't hurt you with the vaccine. And we know that from many, many good studies. So, anybody that has any kind of, by age or by immune compromisation, I mean, the list of things that qualify you, age alone is certainly one of them. Not to mention, you can be younger with type 2 diabetes, or you can have a stent in from, age 43. That qualifies you. So those are the people that get the third dose. And it's a self-declaration. We're not looking through people's medical records. If they come and say, I had coronary artery disease and I have 2 stents or 4 stents and I'm 43 years old, roll up your sleeve.
If someone is eligible for, a senior citizen is eligible for the booster or the third dose, and they've had a flu vaccination recently, is there a time limit in there?
You can get them the same day. We recommend different arms. But, yeah, no.
Commissioner?
Those of us that received the Johnson & Johnson, is there, of course, that was only one shot.
Right.
Is there a timetable for?
There is, actually. I try to keep up with the literature on those ones. The Johnson & Johnson, they have done some preliminary studies with the boosters, and it really boosts the effectiveness. So I suspect we're going to hear that. When? How far from the first dose, that's all we don't know. But I suspect we will get a recommendation at some point about a booster, because it's well in the 90s, the effectiveness once you get the booster. So knowing that it wasn't the most effective vaccine, although we compare everything to, if we compared it to our typical vaccines, like our flu vaccines, which is like 50% effective, and we're saying, oh, this one's only 78%, that's pretty darn good. And so if you boost it up to 90, that'll be great. But I expect that'll be very shortly, we'll hear more about that.
Dr. Bernal, I have one question, and I'm kind of like Commissioner Phillips. You may have answered this. I'm sorry if I missed it. When the information first came out about the idea of a booster, I remember there being some discussion about if you'd had Moderna, then you should get the Pfizer booster. If you've had Pfizer, you should get the Moderna booster. There was some logic there thinking that perhaps it would even increase its effectiveness if you had the opportunity to have one or the other. What I heard you say a little while ago was, really, if you've had either Moderna or Pfizer, you can get either a third shot or a booster, and I'm still not clear on what the difference is in that, but in my mind, it's just a third shot. Is that correct or no?
That don't have underlying health issues. We're just pretty healthy people, and we got our first 2 shots, and the booster is your third shot just to boost the effectiveness. There has been some studies looking at mixing Pfizer and Moderna, and some preliminary studies show that it actually improves the effectiveness. So the recommendation does not worry me when people say you can do Moderna, and then Pfizer. That's the recommendation right now for the people getting the immune-compromised group.
And that's really who you're talking about right now, is the immune compromised.
That's the third dose. The booster dose is just kind of like what we do every year when we get tetanus. Every 10 years you get your tetanus booster.
Okay.
Yeah.
Okay. Commissioner, did you have a question? Or were you just straining to hear? I saw you leaning forward. Were you just straining to hear? Okay.
Just one more follow-up, and I know how personal this sounds, but let's say Joe and I got our second shot in March. Would you recommend the booster now or wait till 8 months?
Oh, I think 6 months is, most of the data is at 6 months and farther. You could wait 8 if you're fairly healthy, but you can do your 6 now. Come on down.
Come on down.
His next question is going to be, do you have any on you? I know where this is headed.
It's that freezer that you have to carry with you.
Yeah, check your purse. Are you sure you didn't have anything? Yeah. Very good. All right. Are there any other questions for them? If not, I will accept a recommendation to accept the report.
So move.
I'll second that with much thanks for all the work that you guys are doing.
Thank you. Thank you so much. We appreciate y'all. All right, all in favor, please say aye. Aye. Any opposed? Very good. Thank you. Thank you, ladies. Appreciate y'all. Okay. All right, community care report. Mayor, do you have anything for us?
Thank you, Madam Chair.
Basically, we are about a week away of finishing the first phase of community care on the wing that we're remodeling. We had to back up behind where the beds were in the rooms that were being remodeled. They were putting kind of a vinyl. It's almost like a paneling, but it was a vinyl paneling to go over the concrete block wall where it didn't look cold for painting the concrete block. And they discovered it started warping and getting ripples in it. So they finally tracked it down, and it was the manufacturer sent down the wrong glue. So they're going to have to they're ripping off all of those panels behind it and starting all over again in all those rooms. As soon as that's done, then they'll start on phase 2. Yeah, but knock on wood, no COVID as of today.
But that's awesome. Any questions? Ms. Carroll, you have anything you want to add? No? All right. I'll accept a motion to approve that report. Good. All in favor, please say aye. Aye. Very good. All right. Special projects, Ms. Jolly. Ms. Jolly sends this report to us in advance. It is paying the bills.
Going to say, that's all I've done is paid the bills. Nothing new to the report.
Good. Anyone have any questions? If not, I'll accept a motion to approve the report. Good, thank you. All in favor, please say aye. Aye. Awesome, thank you. We appreciate you. I know, poor thing, I always hate she has to stay for that.
Rest out for nothing.
I know. All right, school board, welcome. You flying solo?
He had another meeting, and he may be here soon. If you'd like, we have 5 budget amendments for your review, and I've spoke to our new chairman, Tiffany Johnson, at the school board. Just wanted to make you aware, as you see on the front of this, it's agenda items from the September 9th school board, as well as the September 30th school board, which is on Thursday. Our board has already reviewed these. There are two amendments, and I'll touch on them here in a minute, that they'll actually vote on this Thursday. They've already reviewed them in their work session, which was yesterday, and they told me just so we could compile these together and move along these amendments, they gave me the approval to put them before you folks tonight. The first amendment that we see, it is an amendment for increasing estimated local option sales tax in Fund 141 to meet the fiscal year 21-22 state MOE and to budget for some additional non-payroll expenses for increased student enrollment. This amendment increases budgeted local option sales tax in the general purpose school fund by $795,464 in order to meet the state required maintenance of effort for local funding for state BP funds. The GPS fund originally passed the state MOE test for the current fiscal year during the final budget preparations, but fell short due to the final end of June 2021 revenue cleanup amendments for actual collections of sales tax in the fiscal year just ended in 2021. This increase in FY 21-22 estimated revenue will still reflect a conservative amount for annual local option sales tax while meeting the state MOE test requirements. Furthermore, these funds will be utilized to budget for additional instructional supplies, equipment, software, one additional SPED bus contract route that's needed for growth, and contracted services to support the non-payroll needs of enrollment. And I said at $48,200, our 20-day enrollment to show you our growth. The 20th day of school enrollment in last fiscal year from the 20th day of school was 46,633 students. The 20th day of enrollment for this year is 48,635 with an increase of 2,002 students in enrollment numbers. So I just want to make you aware that we've seen some significant growth.
He had predicted that.
So, and if you notice last year we ended the fiscal year with a final ADM of 46,752. So we had a very small, we probably had the smallest growth for a school year in who knows when. But we were one of the few districts out there that actually grew last fiscal year. Most of them had to be held harmless for their BEP. We weren't in that boat. But we obviously made that enrollment number up this year, so we seen another 1,000 growth on that. Mr. Spurlock, would you like to? Yes, sir. Okay. All right. As you can see, the recommended motion for that is to amend the fiscal year 2021 GPS fund budget to increase budgeted local option sales tax by $795,464. And once again, this is still a very conservative budget for that line item to meet the state MOE test, as well as increasing the expenditure budget line items as indicated by the same amount to help support the additional current year student growth.
One quick question to anyone that's listening tonight, if anyone is listening tonight. This sounds like we're raising taxes. That we're not raising taxes and what that means by
Great point. When we worked up the revenue side of the general purpose school fund, we set a conservative, which we always do for sales tax, a conservative but realistic amount. It met the MOE for this is how much local option sales tax coming in. When we ended this last fiscal year, the amount that we had, the final budget amount or final collection, actually created us to not, that amount that met MOE in our budget, on the initial budget, it did not meet it because, once again, the actual sales tax revenue was higher than what we budgeted for the next fiscal year. So we are not, I will reiterate, we are not raising taxes. We are just adjusting our sales tax up to actual collections, closer to.
And Doug, for clarification, this committee knows what you're talking about when you say MOE. Will you explain to those folks watching what the maintenance of effort principle is and why it
Yes.
applies here?
Yes, the state requires a local maintenance of effort to receive state BEP, Basic Education Program funds. Sales tax, local option sales tax, is one of those local taxes that we use to meet that test. And so once again, we, as a growing district, you cannot, as a county, budget less local revenue for your next fiscal year that you budgeted the
For your
fiscal year
past,
before.
yeah.
Yes, and that's what we're talking about for those listening. Any other questions?
Thank you, Doug. Move to approve, Madam Chairman.
And hang on one second, though. Doug, can we take any of these together, or should we take them all separately?
These are all four of these five are in,
141?
Yes, ma'am.
So can we can go 1 through 4?
that's the will of this committee, yes.
If y'all are comfortable with that, then we'll just wait, and we'll take all those 4 together. So, okay with that? Thank you. Very good. Thank you. All right, continue, Doug.
Budget amendment number 2 is in the general purpose school fund again, and this is an amendment for a transfer of special education buses from Genesis Learning, as well as funding for an addendum number 3 for Advantage XP substitute services. This amendment budgets for a transfer of 7 special education buses formerly operated by Genesis Learning to a direct bus contract between RCS and the bus contractors. Funding of $540,766 for these 7 bus contracts to come from a reduction to the Genesis Learning contract due to an amended contract that was approved by the school board to reflect the deletion of bus services from this third-party contract. Additionally, this amendment budgets for a contract addendum Number 3, for Advantage XP, which is our teacher substitute service, with $100,000 of funding coming from ESSER 2 federal indirect costs. And basically what that is we brought those contractors in directly to be contracts with us instead of Genesis Learning. As noted, we amended that contract to reflect the reduction of what Genesis was providing these students that were attending Genesis Academy. And then on the substitute contract, we did an addendum, our board did an addendum to provide some quarantine funding yes sir, 5 days. If we have a substitute teacher that is quarantined due to contact tracing while they are at a Rutherford County school and they are substituting on the job, this will provide 5 days of pay for that substitute to quarantine. And that's similar to what we did with our employees. We did that to encourage, that to let our substitutes know we will take care of them should they be on the job at a Rutherford County school and they are quarantined from contact tracing.
Madam Chair,
Yes, sir.
question. So Doug, that's at the substitute rate, that current rate?
Yes, sir.
Okay.
It is at the current rate that they will
For
receive.
5 days?
Yes, sir.
Okay, thank you.
Of course, the recommended motion for that would be to approve the 2021 general purpose school budget amendment as presented. If there's no other questions on that, I'll move to the next one.
Continue, Doug.
Budget Amendment 3 is to budget the revenues and expenditures for the fiscal year 2021-22 Safe School Grant. This is a routine annual budget amendment. We budget conservatively for the 2 positions in this grant that it funds in the original budget, and then when we have our final award from the state for the Safe Schools Grant, we bring this amendment to tie to actual grant award. This amendment increases budgeted Fund 141 revenue and expenditures to recognize the awarded amount of the fiscal year 21-22 Safe School Grant. This reflects the grant award that was approved by the State Department of Education. This year's grant award amount is $909,209. Recommend motion to amend the FY 21-22 GPS fund as presented to reflect the actual annual Safe School Grant award. Any questions on the Safe School Grant?
No questions on that?
Yeah, I was just going to say you might explain for those listening a little bit about that this is for safety and security and so on in our schools.
Yes, sir. The majority of this funding will go towards this year, will go towards additional security cameras in our schools to obviously to that. We've used it in the past for additional security locks, the pass locks, so we can have better control and security at the schools. But that's the goal of this grant. And of course, we send up our application and it's reviewed by the folks of the state, and they approve or disapprove anything, to make sure it's in line with the grant's objectives. Is there any other question on Safe School Grant?
Next.
Number 4, amendment to budget for 1 additional full-time custodian for the new Laverne Middle Annex, which will be opening here this next month. 1 full-time teacher and 1 EA position for the new pre-K program at Plainview Elementary. Some additional classroom supplies that was provided for by a donation from Nissan, as well as additional PRN nurse funding and contract LPN nurse funding. This amendment budgets for 1 additional full-time custodian position to clean the new Laverne Middle Annex that will open in October 21, as well as 1 additional teacher and EA position to staff the Plainview Elementary pre-K program that was recently awarded grant funding by the state. Additionally, this amendment recognizes a donation of $25,000 from Nissan that will fund additional STEM instructional supplies at 3 RCS schools, Lastly, this amendment budgets for an additional 2,000 hours of school registered nurse PRN pay, along with additional funding for contracted services for 3 contracted LPNs for a 3-month period to assist with the current increased workload of school nursing brought about by the Delta variant of COVID-19. It should be noted that the requested total expenditures increase of $328,069 in this proposed budget amendment. Out of that amount, the recurring payroll-related requests total $129,259, and this amount is further reduced by a recurring state pre-K grant that totals $88,705 for this year. So around $40,000 of recurring that's not taken care of with a grant. Funding for this part of this proposed amendment that is not provided by grant or donation funds will be derived from $214,364 of indirect costs from ESSER 2 and 3 federal funds. And just want to touch on the pre-K, the teacher, the 1 teacher, and the 1 EA at Plainview. The reason we did not put that in the original budget request was we were not informed of the pre-K grant award that we were going to get it. It was a back and forth at the time. We found out in July, you're going to get this funding from the state. So thus, we wanted to get that pre-K program up and going. The 1 custodian for Laverne, we allocate for custodians based on square footage. So we had portables out there, and when you look at the new square footage for the annex, less the amount of the portables that left, there was enough growth of square footage that warranted that custodian position. So that's why that's there. Those are the 4 amendments that I have before you. As you noticed, we have some PRN nurse. That's obviously for some additional help for our nurses during this time, and when they're dealing with a lot of contact tracing and things like that with COVID. Is there any questions on that last amendment?
There's no questions on the amendments for Fund 141. I'll accept a motion.
Motion to approve those 4 budget amendments that we've just discussed.
Thank you.
Second on that.
Very good. Thank you. Since it's money, Rachel, will you call the roll?
Commissioner Cook? Yes. Commissioner Blair?
Yes.
Commissioner Key?
Yes.
Commissioner Virgil Gammon? Commissioner Joe Gurley?
Yes.
Commissioner Phillips?
Yes.
Commissioner Allen?
Yes, thank you. Okay, you got one more?
Yes, ma'am. This last one will be in Fund 189, the building program fund. It's a budget amendment for that. This budget amendment closes out, and I have a dollar difference here. It's the $2,336,386 from the completed, not 5. It's a dollar. That's the dollar we're looking for. It's a rounding issue. But $2,336,386 from the completed Rock Springs Elementary Edition, as well as moving $1,788,301 from the future new elementary projects to help fund the recently approved Rockville Elementary Edition. This amendment also recognizes the breakdown of the awarded contract amounts for the Rockville Elementary Annex, the Smyrna Middle Annex renovations, and the Rockville Middle Classroom Addition. What this amendment does is it cleans up what has been approved by this committee, budget, and the commission when they issued the bonds for these. This is merely just cleaning it up from what has been approved for bond issues and project contracts. Recommended motion is to amend the building program as presented.
So moved.
Very good. Call the roll for us.
Commissioner Blair?
Yes.
Commissioner Key?
Yes.
Commissioner Gurley?
Yes.
Commissioner Phillips?
Yes.
Commissioner Cook?
Yes.
Chairman Allen.
Yes, thank you. Anything else for us? Wait till you take the microphone. Folks can't hear you at home.
Yeah, just give an update real quick. Our data on COVID, we had been averaging like 3-digit numbers on positive cases for our students. Today we had 24 and only 1 staff member. So we're seeing a trend going down. We're very encouraged because we need our kids in school.
Commissioner Key?
Madam Chair, just a quick question for Doug. On these reports to Fund 141, is it possible to, this is my linear brain, to line up the columns symmetrically a little better?
On the Fund 141?
On those 4 or 5 that you proposed. I can follow it, but
You're talking about on the Fund 189, sir?
that's right.
Yeah.
Just on the sheet itself.
I can, yes, sir, I'll do better.
Just have somebody do that, if you would. It just helps my brain. Thank you very much.
Any other questions for Superintendent or Doug? All right, you're getting off easy tonight, man. Thanks for coming.
All right.
All right, is there any other business for this committee? Very good. We are adjourned. Thank you.